Our final guest is Shelia Roberts of New Hope Clinic. Welcome to the show today, Sheila. It's such a pleasure to have you here.
It's wonderful to be here. Thank you for the opportunity.
Well, great. Now, I know we're going to learn a little bit about you and about the clinic, about New Hope Clinic, so I'm really excited about that. But let's start with your role. What is your role at New Hope, and tell me about your background.
Sure. I'm originally from a tiny town in central New York, and I have a bachelor's degree in health and society and a management certificate in public sector analysis from the University of Rochester in New York. I've moved around a bit. My husband was in the military, so I worked in different industries throughout that, had some opportunities. And then in 2008, when he got out of the Navy, we chose the prettiest place with a nuclear power plant. And I became a volunteer at New Hope Clinic. And then in 2009, I was appointed as executive director. So I kind of make sure everything is running, that the clinic is running as efficiently as possible, helping our providers get the care they need and keep the organization going.
As long as I've known you, I didn't realize you started as a volunteer.
Absolutely.
What did you do?
One afternoon a week. I started out helping with some computer work, turned into 2 afternoons a week, and it grew from there.
Wow, that's amazing. And what a great executive director you are. You've done a fabulous job.
Thank you.
Let's talk a little bit about the clinic's mission. Some of our viewers out there may not be very aware of the New Hope Clinic, so let's share a little bit about their mission and their history. How did it all begin?
Sure. New Hope Clinic is an independent 501c3 charity. It was founded in 1998 to ensure that the low-income uninsured have access to health care. Mm-hmm. It's grown and changed over years quite a bit, but our mission remains the same. Mm-hmm. We're providing medical and dental care, prescription medications, diagnostic testing, and health education to the individuals in Brunswick County who are adults and can't access health care a different way. They're low income and have no insurance, so they don't qualify for Medicaid or Medicare, can't qualify for those, yet don't earn enough to purchase private health insurance or a doctor's appointment on their own.
Mm-hmm. So they kind of fall through the cracks.
That's it. We're trying to be our community's answer to the gaps in our healthcare system.
Mm-hmm. Yeah. Wow. So what types of patients are primarily served by New Hope Clinic? Are they medically? I mean, is it like diabetes? What kind of things do you see?
We're a lot like a family practice where you get patients with all sorts of medical needs. Many of them do have chronic diseases like diabetes, hypertension, high cholesterol. We can also help perhaps a younger individual who has a periodic infection or some care that they need. We're just trying to make an option for someone who can't get to a regular doctor's office, help them before they get to the emergency room or before the condition becomes too serious. If they might qualify for a different program, we'll help them get connected to that. But we want to get them enrolled in our system so that we can give them an option to be healthier, care for their families. Some of our patients are working, some are not. It could be someone who's had a job their entire life, and then they lose that and they lose the insurance benefits along with it. So we try to help them get through until then. Could be a senior who's on Social Security income, but not old enough to qualify for Medicare yet.
Right.
So we all see all sorts and do what we can to help each one of them. Every case is very different.
So you don't see children, is that correct? It's just adults only?
That's correct. Most children in Brunswick County would qualify for Medicaid or Health Check, Health Choice programs, where their parents or the grandparent caretakers may not qualify for that.
And do the patients only come when they're sick, or do they come just in general?
Just in general, we hope. We want to see them to keep them healthy, keep them well. Absolutely. A lot of patients will come every 90 days for regular doctor's appointments like a family practice would. Yeah.
Wow. Well, how about payment? Is there a charge?
Every service is provided at our facility is free. Many of the patients will make some contribution as they can, but we don't require it. When services are required beyond what we can do at the clinic, we work with hospitals and private practice doctors to try to arrange something for them for medically necessary care that could either be free or at a reduced cost or set up a payment plan. But we're truly a free clinic.
That's unheard of in these days. Well, you mentioned the providers, the physicians. Tell me a little bit about the doctors that do help out at the clinic and what kind of services do they provide there?
Yeah. Well, we are a volunteer-driven organization.
Right.
We have over 150 volunteers every year. Last year, they contributed over 11,000 hours of service. Everything from receptionists to dental assistants. We have a small paid staff, including some healthcare professionals, but we have doctors, some from Novant, physician's assistants, nurses who help. They're all fully licensed North Carolina professionals that are credentialed, so it's top quality healthcare that's provided on site. Most of our visits are primary care doctor visits, like a family doctor. We also have some specialists on site. We have an endocrinologist. And then we work with Cape Fear HealthNet to get additional services with private providers, like a gastrointestinal group that has agreed to take a certain number of our patients to help out with medically necessary treatment again. We also have health educators on site. We provide one-on-one diabetes education, as well as we have groups that are available to open to the public. We do one class in Boiling Spring Lakes and one class in Shelia at the Senior Resources Center.
Wow.
We have a limited dental clinic where we provide urgent care and some restorative and preventive, and we have a licensed pharmacy on site as well.
So you have a pharmacist?
We do have a pharmacist. We have 9 pharmacists who volunteer with us.
Wow.
We can always use more. We also have optometrists, especially for our diabetics. It's important to get their eyes screened every year so we can halt progression of that disease in their eyes.
Wow.
And keep people working. There's a little of everything under our roof.
Well,
we do that at our 2 locations. Our main clinic is in Boiling Spring Lakes, where we're open 5 days per week.
and now you have one in Shelia,
Yep,
right?
we have a satellite clinic in Sheila that's co-located with the Brunswick Family Assistance
Nice.
Agency. We have a lot of crossover in needs with the organizations, and that clinic is open limited hours.
Well, I guess with all that free care, we have to get the money somewhere. So tell me about the funds. How do you raise funds for the clinic?
Most of our funding is local. We're truly a community organization. We get funding from private foundations, United Way. A lot of civic groups support us, individual donations, corporate sponsorships, and then we have special events as well.
So I know you've got a special event coming up pretty soon. So tell me about that.
This is a fabulous event for us. It's a partnership with the Southport Rotary Club. They focus on helping the youth and the health needs of our community as well. So they came to us several years ago, and it's called Go Jump in the Lake.
Go jump in the lake.
It's a run walk held on the Saturday of Labor Day weekend in Boiling Spring Lakes. It's a community fun fitness event, but it's also got a little bit of a competitive edge to it.
Right, yeah.
We have a 10K, a 5K, and those are chip timed by Go Time, so a professional timing company. That's what the competitive people are looking for, I think. But you can also walk those. And then we also have a 1.5 mile fun run walk.
Right. Now, it's in Boiling Spring Lakes, and what time of the day is it?
It's on that Saturday the 2nd, starting at 8:30 in the morning.
8:30.
That's the first race, and then the others go after that. We'll have some food vendors, food trucks on site, and some activities for kids, so you can bring the whole family out. There's discounts for children to participate, as well as for active duty military, EMS, our public servants, trying to make sure that everyone has an opportunity.
Sure. Well, how can we sign up?
Go online. There's information either from the New Hope Clinic website, Southport Rotary website, or through the timing company Go Time. There's also a Facebook page, or you're welcome to call the clinic for more information.
And what is the number at the clinic?
The phone number is 910-845-5333. That's the phone number you could use for event information, as well as learning about how to be a patient or volunteering.
And so you're always accepting volunteers, correct?
That's right.
So
we do.
we can call, if anybody out there is interested, they can just pick up the phone and call you, and you'll just find a job for them, right?
We do find a job for just about everyone.
Great.
There's also a link to our application and information about the positions on the website for newhopeclinicfree.org if you go to the volunteer section.
Great. Well, I look forward to the race, and I look forward to having you back to see how it went, and we'll learn some more about New Hope Clinic. So thanks so much for being here today.
Thank you so much, Jane.